So you remember yesterday's class, like what we have seen, medical terminology. So what is root, what is prefix, suffix, combining vowel, combining form. So the root is nothing but it is the main term in a medical word. And prefix is before the root word we are adding something that is nothing but prefix, and the end of the word is suffix. Combining vowel is nothing but the letter O in the English alphabets. The letter O will combine root to root or else root to suffixes, and combining form also we have seen, right? So all these are the things we have seen yesterday. So our today's session will be the continuation of the remaining medical terminology. So yesterday's class, it was clear. Do you have any doubts? Any doubts are there
No, ma'am.
for listening to the session? No?
No, ma'am.
Okay, okay. So let me start today's session. So apart from the yesterday's session, you should also know some important terminology. Why? Because when you will be learning the surgery coding, so in the surgery coding, the language is a little bit difficult. So to understand that language, you should know these terminologies. And these kind of terminologies will be regularly used in the surgery. So that is the thing. Today's class is important. Okay. So what is a scope? As you can see here in the picture, what physician is doing? He is inserting some scope. So this scope consists of some camera. Okay. So by sending the scope inside the body, they can see what is the problem. So what is a scope? It's the instrument which is used to see the body, to diagnose the problem. So for example, you can see this scopy word in the terminologies like colonoscopy, arthroscopy, gastroscopy. So what is colonoscopy? So in this colonoscopy, the physician, he will examine the colon. What is the problem? What is a colon? Which is nothing but a large intestine of the digestive system. So they will insert the scope like this and they will examine. So here if you see in the colonoscopy, the last word scopy is there. Even in arthroscopy also it is there. So you're able to understand, right? Like what is scope and where you will be getting these terminologies, and the same kind of terminologies you can see in the surgery CPT coding also. Okay. Now what is arthroscopy? Scopy is what now? It is nothing but examination. Now what they are examining here? Arthro. What is arthro? Nothing but a joint. What about gastroscopy? Now scopy is, we got to know it's the instrument to view inside. And what about gastro? Where they are examining? In the stomach. Okay. So like this, the terminologies will be there. Okay. For the scope. Now next comes algia. What is algia? Algia is nothing but pain, or we will call it also as a ache. So example where you can see this terminology. Cephalgia. Now algia is what? What is the meaning of algia? It is nothing but pain. What about cephal? It is nothing but head. Now where is the pain? Head. Head pain or headache. Okay, ache is nothing but pain. Algia also pain. Both are nothing but the algia only. Okay. Now where we can see the terminologies. Arthralgia, which is nothing but algia is what? Pain. Arth is nothing but joint. Fibromyalgia. Algia is pain. Where is the pain? Myo, nothing but muscle pain. Mastalgia. Algia is what? Pain. Masto is what? Breast. Okay. Similarly, you can see myalgia. Algia is what? Pain. Myo is muscle pain. Okay. So in this way, you can see the algia terminology. So You are able to understand, right, Mahesh and Shravani?
Yes, ma'am.
Able to understand, right, what I'm saying, Mahesh,
Yes, ma'am. Yes,
Shravani?
ma'am.
Yes,
Okay,
ma'am.
okay.
Yes, ma'am.
Okay, thank you for confirming, ma'am. Okay, so next is ITs. What is ITs? ITs is nothing but swelling. See, this is the appendix, ma'am, where we can see the appendix in the digestive system, lower abdominal location. Sometimes it will get swelling. So for that swelling in the medical language, we will use it as a inflammation. So inflammation is what ITs. Itis is what? Inflammation. Where we can see this terminology? Appendicitis. Now, itis is what? Nothing but the inflammation. Appendix is nothing but appendix. Where is the inflammation? In the appendix. Okay. So, now here, the question is, now appendicitis is there. Okay. Now, itis is what? Inflammation. Now, this is the end of the word. This we will call it as what? Shravani and Mahesh. According to the medical terminology, the end of the word we will call it as what, ma? It's okay. You are saying right or wrong. No need to worry. Hello.
Can you repeat the question?
Okay. So appendicitis is there. So now itis meaning is inflammation. Okay. Now according to the medical terminology, the end of the word we will call it as what? Yesterday we have seen this. The end of the word we will call it as what, ma?
Suffix.
Very good. Suffix. So you will be like getting a question. The word suffix itis means what? So they will be giving the options inflammation, pain, like that. Okay, now you understood, right?
Yes, ma'am.
You're okay, okay, ma. Thank you for confirming. Okay, next. Arthritis, blepharitis, bronchitis. Now, what is itis? Itis is there in this all three words. Nothing but inflammation, inflammation. Where is the inflammation? Arth, joint, blephar, eye, bronchi of the lungs. Okay, which are nothing but the airways. So in this way, you can see the itis. Now here we go, the other terminology, that is otomy. What is otomy? What is otomy? Nothing but cutting. They are cutting some organ. They are doing the incision. Cutting, incision. Otomy is what? Incision. They are cutting. Okay. So, otomy is cutting. Now, where they are cutting? Gastrootomy. Gastro is what? Stomach. They are cutting the stomach. Now, if you take other terminology, hysterotomy. Otomy, you can see everywhere. Otomy is what now? Incision. Where they are doing the incision? Uterus. Phlebotomy. Phlebi is nothing but, ma, it is vein. Vein. For vein, we will call it as a phlebo. Next, laparotomy. Otomy is incision. Laparo meaning is nothing but abdominal wall. Abdomen, we will call it as a laparo. Okay. So next, myotomy. Otomy is incision. Myo is what? Muscle. In the muscle, they are doing the cutting. Next, thoracotomy. Otomy is incision, cutting. Where they are doing the cutting? Thorax. Okay. So, in this way, you can see the otomy in all these kind of words. Okay. Till here, it is clear, both of you. Do you want me to repeat anything, ma'am? Or shall I continue?
Okay, ma'am. Continue.
Mahesh, what about you?
Yeah, ma'am. Continue. I will
Oh,
understand.
okay. Next is plasty. What is plasty? Plasty is nothing but repairing. For example, we got some electrical problem in our home. What electrician will do? They will do the repair. Similarly, in our body, there is some defect. What provider will do? He will do the repair. So, plasty meaning is a repair. Okay. For example, there is some cut in the lips. Slitting we will call. Okay. So, plasty is a repair. What about kilo? Kilo is nothing but lips. So, lip plasty, they are doing the lips repair. There is some cut. Okay. So, there is a cut. What they are doing? They are doing the suturing. Nothing but the threads they will be using, surgical threads. So, with that, they will do the suturing. Plasty repair. Okay. Be perfect with this medical words because this is also helpful for your interview. Okay, not only interview, but these kind of terminologies you should know. Okay, next comes hip arthroplasty. Now, plasty is what? They are doing the repair. Where they are doing? In the joint arthro. And which joint it is? Hip. Hip joint. See here, this is the artificial one. They will place and they will do the repair. Okay. So, in this way, you can see the repair, which is nothing but plasty. Okay. They will do the repair either with the artificial one or with the help of the sutures. Okay. Next comes a refi. Refi is also repair. So refi, plasty, all these are same kind of terminologies. Refi and plasty both are same. Okay. Refi is suturing only. Okay. Here you can see hernia-refi. Refi is repair. Where they are doing hernia. Now here what is hernia? Hernia is nothing but it is a bulging we can see in the body. Why this hernia will occur means because of the weakness of the vein at this particular area. So it will cause the hernia. Okay. So the provider will do the repair of this hernia, which we will call it as a hernia-refi. Okay. Refi is there here. You can see. Okay. Next, you can see in other words also, like a cardiorrhaphy, nephrorrhaphy. Cardio is what, ma? Heart. They are doing the repair in the heart. Nephrorrhaphy. Raphy is what? Suturing. Nephro is what? Kidney. So, in the kidney, they are doing the repair. Maybe some problem is there, like some tumor growth or some laceration might be happen because of some severe injury. So they are doing the repair, nephrorrhaphy. Okay, so in this way, the raphy you can see in this medical words. Okay, now next comes ectomy. What is ectomy? Ectomy means what? It is nothing but surgical removal of some organ or some part of the body tissue, some body part. Ectomy, removal. Where can we see this? Colectomy, gastrectomy, lumpectomy, myomectomy, nephrectomy. Now here, ectomy is what? A removal. Where and in which location they are removing? Colon, which is nothing but the large intestine. Okay. Ectomy means removal. Gastrectomy. What they are removing? Ectomy is what? Removal. Gastroectomy. They are removing the stomach, which we will call it as a gastrectomy. Next comes lumpectomy. Ectomy is removal. Lump. Some portion. Lump. They are removing it. Next, myomectomy. Ectomy is removal. Myo is here. Myoma is nothing but fibroids. As you can see here in the picture, in the uterus of the female reproductive system, sometimes some abnormal growth will be formed, which we will call it as a fibroids. Okay. So they will be removing this fibroids. So in the medical language, we will be calling it as a myomectomy. Okay. Next comes nephrectomy. Now ectomy is a removal. Nephro is what? Kidney. So they are removing the kidney. Okay. So in this way, ectomy terms will be there. Okay. Now next comes ostomy. What is ostomy? Ostomy is nothing but they are creating an opening. For example, the patient is unable to pass some urine or unable to release the feces. Okay, so what they will be doing, they will create one opening from inside to outside of the body, as you can see here. So this is the colon, large intestine. So they are creating an opening to remove the waste from the body. Okay, so ostomy means what? Creating an opening in the body to allow the waste to exit. Where can we see? Colostomy, ileostomy. An opening is created in the colon, ileum. Okay. Ostomy means what? Opening. Here also you can see urostomy here. The urine is passed from inside to outside of the body. Why? Because some problem is there here in the ureter. So they will be creating an opening outside of the body and they will be fixing with some Foley catheters. Okay, so they are creating an opening outside, which is nothing but ostomy. So most common type of ostomies we can see colostomy, ileostomy and urostomy. Now what is ostomy? Nothing but the opening. Why they will create this opening? Because to remove the waste from the body. Otherwise, it can lead to the death of the patient. So that is the reason they will create from inside to outside of the body to remove the waste. Okay. So these are the types of the ostomies. Okay. Now next comes opexy. What is pexy? Pexy is fixing something. Fixing something. For example, the breast is saggy. So what provider will do? They will fix the breast. So pexy is fixing. Masto is what? Breast. So they are fixing the breast. Opexy. Orichiopexy. Pexy is what? Fixing. What they are fixing? Testis. Orichio meaning is nothing but testis. Okay. So some males, they will have a undescended testicles. As every male will have this testis. So one will be undescended. That means it will be moved inside the scrotum. So generally the testis will be like this. So undescended testis means one will be normal and other will be inside of the scrotum. So to bring it back, they will fix this. Fixation they will do, which is nothing but orichiopexy. Okay. So that is the pexy terminologies. Okay. Now here we go. You have to fix this terminologies. Okay. I'll explain one thing. So the remaining you have to do. Okay. So the remaining you have to do. Now, whatever we have learned, you have to fix all these words. Now, for example, ophthalmotomy is there. Okay. All together, we will call it as a ophthalmotomy. So here, what is the meaning of this? Ophthalmo means what? Here you can see eye. So what they are doing? Otomy. Otomy is what? Cutting in the eye. So like this, I want you to write for remaining also. Okay. Now next we can see ophthalmoplasty. Plasty is what now we have learned. What is plasty? A repair. So they are doing the repair in the eye. Next, ophthalmology. What is logy? Logy is nothing but study. So where they are doing the study? In the eye. Similarly, ophthalmoscopy. What is scopy? We have seen examination. Examination of what? Eye. Next comes ophthalmologia. So what is algia? We have seen pain. Okay, pain in the eye. Next comes ophthalmitis. What is itis? Inflammation. Inflammation where ophthalmo is nothing but eye. So in this way, you can try remaining. So I'll be dictating the notes for today's session. You can take down the notes. Write down heading, medical terminology, class 2. Hello. Hello.
Yes, ma'am. Yes, ma'am.
Um, okay, so take down the notes for today's session. Write the heading as medical terminology class 2. And then write scopy. Scopy, right? The notes, scopy. And after that, you write scopy means what? It's the instrument used to view inside the body. That's it. Don't write all this, okay? Scopy is instrument used to view inside the body. Scopy is instrument used to view inside the body. Example, colonoscopy. Now what is scopy? Examination. Where they are examining? Inside the colon. And after writing the meaning of scopy, take down only one example. Okay, only one example is enough. And one more thing, from tomorrow onwards, the link is going to be changed. And I request who wants to continue the session, please pay the fees so that you will be getting the access to everything and the notes and the classes and everything. Okay. So I request to pay the fees if you want to continue. Okay. Next examples. And if you have any concerns, any doubts are there, you can contact the Durga Software Solutions team members. Okay. Scopy is instrument used to view inside the body. And example is colonoscopy. What is colonoscopy? It is a procedure used to examine inside the colon. It is a procedure used to view inside the colon. That's it. If it is done, I'll go to the next thing. If it is done, I'll go to
Yes,
the
ma'am.
next. Okay. Next, algia. Algia. Algia is nothing but pain or ache. Example, cephalgia. Algia is what? Pain. Cephal is what? Head, which is nothing but head pain. Okay? Write all these three things. If it is done, then I'll go to the next one.
Ma'am, Cepha means
Cephalgia. Head pain or headache.
Cepha.
Head pain or headache.
Okay, ma'am.
Thing is fine. Because algia meaning is either pain or ache. Okay.
Okay, ma'am.
It's done, ma'am.
Okay. Next write down ITs. ITs is inflammation or infection. And take down this example also. Appendicitis. ITs is inflammation or infection, and the example is appendicitis, which is nothing but inflammation of the appendix. Once it is done, please confirm so that I'll go to the next one. IT is nothing but inflammation or infection. Appendicitis. Inflammation of the appendix. And then tomorrow who are going to join, I'll be sharing all these notes. Okay.
Yes, ma'am.
Okay. So the next thing is automy. Automy. Automy is what? Cutting or incision. They are cutting. They are doing incision in particular location, organ, or particular site. For example, gastrotomy. Otomy is cutting. Where they are doing the cutting? In the stomach. Okay. Otomy, cutting or incision. Both are same, cutting or incision. And take down the example gastrotomy. Gastrootomy.
Okay, ma'am. Scroll down, ma'am. Yes.
Why I'm not giving meaning examples? Because once you will be in from tomorrow, I'll be sharing this. Okay.
Okay,
Next
ma'am.
is plasty. What is plasty? Nothing but doing the surgical repair, suturing. Okay, example is kiloplasty. Plasty is repair. Kilo is nothing but lip. Lip repair they are doing. Okay, so take down this medical term plasty and then example kiloplasty. Okay.
It's done, ma'am.
Okay. Next comes refi. Rafi is also suturing and repair. And the example is herniorrhaphy, which is nothing but repairing of a hernia. Okay, take down this terminology, Rafi, and also take down this example. Once it is done, I'll scroll it down. And please learn these terminologies, okay? Apart from like listening the session, I also request to spend some time for this terminology, okay? So every day you have to spend some time to learn not only like today's class, tomorrow's class, every day, all 3 months, you have to do the hard work, okay? Ketan, may I know about you? Hello. I could see the participant, one of the participant as Ketan. So can I know about you? I mean, like there is no interaction at all with you. So I just want to know, am I audible to you, Ketan? Um, why so you are typing uh, hello, Ketan, can I know about your introduction? I know about Mahesh, Maulika, Shravani. Ketan, can I know about you, please? Go ahead and introduce yourself. You're having some issue. Okay, at least you can give me an intro in chat box, like what is your graduation and you're from which location? Maulika, hi Maulika, you're there? Hello, Maulika. Maulika, actually, our team members are trying to reach you so many times. Can you please give your details to the team members in the chat box? Why? Because they are trying calling you since from very long time, but it's showing something like unavailable something. So please give me your details, at least your mail ID or something like WhatsApp number, mobile number, something in the text box so that they will be reaching you. Why? Because you'll be continuing or not, they will be getting to know. So that is the reason I'm asking now. So, Ketan is saying You're currently working as a QA. Where you are working as a QA, Ketan? Why? Because from tomorrow onwards, the link is going to be changed again. So I'm repeating again, from tomorrow onwards, the link is going to be changed. Once you will be like paying the fees only, like you'll be having the access for the classes from tomorrow. Okay, so now where we are in the refi. Okay, refi means suturing, and this is one of the example, Hanio refi. Okay, so refi means suturing or surgical repair. Hanio refi is the example. So this is done. Shall I scroll it down for the other thing?
Yes, ma'am, completed.
Okay, okay. Next is ectomy. What is ectomy? Ectomy means surgical removal of body part or tissue. So one of the example is like colectomy. Only take down this one example is enough. Okay. Write down what is ectomy, surgical removal, and then this is one of the example. Ectomy is removal. Coli is nothing but colon. So they are removing the colon. Okay. Take down this medical term and take down this example. Once it is done, I'll scroll it to the other thing. Okay.
Yes, ma'am, scroll down.
Done. This part
Yes,
is
ma'am.
done.
Yes, ma'am.
Okay. Holika is there. Okay, then. Okay, okay. So they have. Okay. Ectomy is done. Next is ostomy. Don't write all this thing. Just write ostomy means creating an opening in the body. Ostomy means creating an opening in the body. Ostomy means creating an opening in the body. And you can take down this example, ileostomy. Ostomy means creating an opening in the body. And you can take down one of the example, which is nothing but ileostomy, creating an opening in the ileum. Okay. And ileum is nothing but it is a part of the small intestine. So we have three parts in the small intestine: jejunum, duodenum, and ileum. Okay. Ostomy means creating an opening in the body. And then example is ileostomy. Once it is done, we'll go to the next thing.
Yes, ma'am. Completed.
Okay. What about others? At least you can give me a confirmation in the chat box. Only one person is responding.
Yes, ma'am. It's completed.
Okay. Next is OPEXI. PEXI is nothing but fixing. Okay. Take down this meaning and then take down this example also, mastopexy. Nothing but fixing the breast. Once it is done, we'll go to the other thing. Is it done? Shall I scroll it down?
Yes,
Pexy
ma'am.
means fixing. Example is mastopexy, fixing the breast. Okay. Next. Next, as I told, this is like one of the activity kind of thing where you have to do from your end. Okay. So here we go. I discussed one thing. We also have with auto. Auto meaning is what? Auto meaning is ear. Now, auto plus automy, what it will be? Autotomy, which is nothing but cutting the ear. Otoplasty. Now, what is otoplasty? Please give me the answer in the chat box. Auto plus plasty. Now, what is plasty? What is auto? Club together, you will get the meaning. Try
In
everyone, please. Try.
inflammation, madam.
Plasty is what, ma? You have written the notes also, right? Plasty meaning is what? Plasty. Auto plus plasty, I'm asking. Auto is ear. What is plasty? What is plasty? You have written the notes, right? Plasty. What
Surgical
is?
repair.
Yes. So, auto plus plasty means surgical repair where in the ear. Okay. So, plasty is a repair and then auto is ear. Okay, Shravani, now you got it. Hello? Hello?
Yes, ma'am.
You got it? You got confused or what? Now, is it okay? Oh,
Yes,
now what?
yes, ma'am. Yes, ma'am.
Yeah,
Okay,
repeat.
ma'am.
ITs plus auto. What you said? Inflammation. ITs
Yes,
means
ma'am. It's inflammation.
inflammation
Yes,
in
ma'am.
the ear. Okay, got it. Now
Yes, ma'am.
okay. Now let's take algia. Algia plus auto. What is algia? What is algia? Try. Not an issue. What is algia?
Algia. Pain.
Ah, very good.
Pain,
Pain.
madam.
Pain plus auto. What is auto now? Ear.
Ear.
So,
Ear pain.
Otalgia means what? Otalgia means ear pain. Very good. Perfect. Okay. Similarly, auto plus scopy. Otoscopy. Nothing but examination of the ear. Okay. So like that we have with the other terms also rhino, gastro. So once like you will be in, you'll be getting this notes so that you can practice from your end. So now I'll give just one more example. Okay. That is hepato plus plasty. What is hepato? As per the picture, you can see the meaning here also. It is there. What is hepato? Hepato means what?
Liver.
Very good. Hepato plus
Liver.
plasty. Plasty means what?
Surgical repair, madam.
So where they are doing the repair? In the liver. Hepatoplasty. Repair in the liver. Okay. Got it? So in this way, you should know like the root meaning and then the suffix meaning and everything. Okay. And some of the common symbols where you will be coming across in this medical coding training. So if you could see this symbol, it indicates that it is used for the females. And if you could see this kind of symbol somewhere in the books or under some codes, it indicates that is applicable only for the males. And this increasing symbol, you can see decreased symbol, plus and minus, which is nothing but present. Minus is nothing but absent. For example, a woman, she underwent a urine pregnancy test. So the result is positive. They will indicate like this. So this meaning is what? It is present. Okay. So like this, you will be coming across through some symbols also. So you should know this symbols also. Now next comes the positions of the body. Now, why this part is important? Because so whenever the physicians will be doing the surgeries, whenever physicians will be doing the surgeries, they will mention in the operative report about these positions. So that is the reason you should know the positions. For example, a physician is doing some surgery to a patient. So he will mention, I started the procedure from anterior side of the chest. That means what? Anterior means what? Front side of the body. Posterior means what? Back side of the body. So, knowing the positions of the body is very, very important. Why? Because you will be coming across all through this terminologies in the surgery coding, which is nothing but the CPT coding. Okay, got it right? What I'm saying, the statement, you're able to understand, right? Is it difficult or you're able to understand everyone in the session? Okay, no response. At least,
Please repeat once again.
okay. So, knowing the positions of the body is very, very important. Why? Because when physicians are doing the surgeries, you will be coding the surgery coding only, right? For a surgery, you will give a code, right? So, there will be mentioning some positions in those surgery documentation. You will be getting a documentation. So in the documentation, they will mention like anterior side, I have started the procedure. Posterior side, I have started the procedure. What is this anterior, posterior? It is nothing but anterior means front side of the body. Posterior means back side of the body. Now got it?
Yes,
Yes,
So
ma'am.
ma'am.
they
Yes, ma'am.
said from backside. They will not mention backside, ma. They will not mention backside. They will mention in the operative note. I have done the incision from the posterior side. Now, what is posterior? Backside.
Backside.
Yes, sometimes they will be mentioning anterior side. What is anterior? It is nothing but the front side. So that is the reason knowing the positions is very, very important. Okay, when you go to live coding also, it will be useful not only for the training part and for the CPC exam part, but also for the live coding also it is helpful. Okay, and in order not to get confusion, I added the pics also here. Okay, you can see very clearly anterior means front side of the body. Posterior means back side of the body. Okay, next comes medial and lateral. What is this medial and lateral? Medial is nothing but towards the body, center, middle. Okay, so medial is nothing but midline of the body. What is lateral? Away from the midline. So this is the midline. So this is the midline. So whenever it is towards the midline, we will call it as a medial. Lateral means away from this midline. Okay. If you see one example, the nose, where it is in the middle of the eyes, in the middle of the eyes. So how they will document the doctor? The nose is medial to the eyes, middle of the eyes. And if you take lateral, the ears are lateral, away from the eyes. Okay, so like this you will be knowing this terminologies. Next comes proximal and distal. I'll explain this with one example. Now, if you see, this is a bone, okay, which is a structural support of our body. Okay, this is a bone. Now, in generally, what is fracture? Fracture means what? It is a breakage of the bone. Now, how the provider will document where is the breakage of the bone? So, they will document proximal end, distal end. What is proximal? Nothing but upper part of the bone. What about a distal end? It is nothing but lower end of the bone. Now got it? Proximal and distal. So there is a fracture in the hand where it is proximal hand, distal hand. Okay. So this is the middle part. Okay. Upper end, proximal, lower end, distal. You are able to understand everyone who are there in the session.
Yes, ma'am.
Yes, ma'am.
Did anyone left from the session?
Yeah,
I could see.
Maulika is left.
Okay. Okay. We'll continue the session. Okay. Now next comes superior and inferior. What is superior? Superior is nothing but above. Inferior is nothing but below. Okay. Now if you see the example, how the chest is located. Now this is the chest. Superior to the
Superior.
abdomen. Yes. Abdomen is there. Superior to the abdomen. Okay. Now if you take the legs, how the legs are? Inferior to the abdomen. Okay. So superior is above, inferior is below or towards the feet. Okay. Next comes superficial and deeper. So this is very, very important. Why? Because you will be coming across this terminologies regularly. Okay. Superficial. What is superficial? Ma? Superficial is nothing but upper part of the body. Deeper means inside the body part. Okay. For example, like patient had some laceration. What is laceration? What is laceration? Laceration is nothing but cut. For example, I am cutting the vegetables. I got a cut. So in medical word, we will not call it as a cut. We will call it as a laceration. Now, the doctor will ask or the doctor will check the patient how it happened and all story kind of thing. We will be explaining like this happened and all. Okay. Now, the physician, he will check the problem. So, and he will document, like he will document the cut is only to the superficial layer. That means only to the upper part of the body, there is some laceration. Sometimes they will also document the cut is deeper. That means it is up to the bone level, the cut is there. So you are able to understand, right? Superficial and deeper. Superficial is nothing but the upper layers. Deeper is nothing but inside. Okay. So that is the difference between the superficial and deeper. You're able to understand, right? Here also you can see the superficial and the deeper. If you take the lungs, where are the lungs located? Deeper inside the body. Okay. Next. Next is ipsilateral and contralateral. What is ipsilateral? Ipsilateral means on the same side of the body. On the same side of the body, we will call it as a ipsilateral. For example, patient has underwent some surgery. So they will document ipsilateral side. So ipsi means what? Same side. So they are doing the surgery, right hand, right leg. And that too, it is on the right side only. Both they are doing same side, ipsilateral. What about contralateral? Contra means what? One side is this side, right side, other side is the left side. Okay, got it right? So in generally, when you come across the surgery coding, you will be getting this kind of terminology only. Ipsilateral and contralateral. So the provider has done the breast biopsy. Biopsy means what? They will take some sample and send it to the path and lab. So they have taken the sample on the ipsilateral. Ipsilateral means same side. Contralateral means they are taking the sample from right side breast. They are taking the sample from the left side. So this is contralateral. Okay. Got it right? Everyone in the session? You're
Yes,
able to
ma'am.
understand? Okay, perfect. Ma.
Yes,
Thank you
ma'am.
for. Okay. Next. Unilateral, bilateral. What is unilateral? Unilateral is nothing but one side. Bilateral means what? Both the sides, as you can see in the picture. Why? Because you will be coming across these terminologies also. For example, like a patient has underwent some surgery. Okay. So that is on the hand. So only one side they are doing. In generally, we will tell like that. But the provider use the language unilaterally. I have done the procedure. That means only one side they are doing the surgery. What about bilateral? The surgery was done both the sides, right side, left side. Okay. So both the sides, the surgery was done. This is about the unilateral and bilateral. Next is cephalic caudal. Cephalic caudal is nothing but these kind of terminologies we will be coming across through the about the fetus surgeries or something like OB-GYN surgeries. The baby is in the cephalic position, the baby is in the caudal position. Okay, so cephalic is nothing but towards the head. Caudal is nothing but towards the lower part of the body. Okay. Next is prone and supine positions. This is very, very important. Why? Because you will be getting the operative note, the surgery note. They will document the provider has made the patient in the prone position, supine position. What is prone position? As you can see in the picture, prone is what? Lying face down. Supine is face up. As you can see how the position of the face and the body upside, right? Prone means it is towards the face is downward. Face is downward and the body is also like this. Okay. So face up, face down. And how you will get the documentation like this. The patient is in the prone position. The patient is in the supine position. You will be getting like this only the documentations. Now we are able to understand, right? What is this prone position, supine position and all those things. Okay. Next comes like a palmar and the plantar. Okay. Palmar is nothing but the side of the hand. Plantar is nothing but the sole of the foot. Okay. So these are the basic like positions of the body you should know. So today's session was about the medical terminology and also the positions of the body. Okay. And then here we go like I added one kind of Q&A. So you can try from your end. Okay. You can note down or you can take the snip of it. Okay. You can take the snip or you can write this. What is pain now? What is pain here? Pain means what? Is it automy, algia, allergy, plastiscope?
Algia, madam.
Very
Algia.
good. Pain is algia. Perfect. What is surgically forming? What is surgically forming? Nothing but surgical repair. Surgical repair. Ah, try. Try.
So,
It's done only.
plastic.
Very, very good. Plastic. Next, instrument to view. What we will call it as instrument to view?
Scope.
Very
Scope,
good.
madam.
Good, very good. Next, what is cutting? What is cutting? Cutting. Incision, cutting, other word. Try.
Logi.
Logi is a study, na? What is cutting?
Oh, cutting.
Cutting, incision.
Octomy.
Automy. Okay.
Octomy, madam.
Study of something, we will call it as what? For example,
Logi.
cardiology is there. What is this? It is logy is nothing but study. What we are studying about the heart. So study of something is nothing but logy. Okay. And here we go. We have some more also. You can take down this. So this is all about the today's session. And you have any doubts, can ask me now. I'll give 5 to 10 minutes. Any doubts are there?
No, ma'am.
No.
All good to go then. Okay.
Yes, ma'am.
Repeating again, from tomorrow onwards, the link is going to be changed. So the one who will be paying the fees, only for them the access will be there. So this is all about the medical terminology. And from tomorrow onwards, I will be starting the anatomy classes. Okay. And once the anatomy is
Okay.
complete, will be going to the ICD and CPT also.
CPT.
So this is all about the today's session. Thank you everyone for joining. Okay. Okay.
Okay, ma'am. Thank you, ma'am.
Thank you. Ketan, can you stay? Ketan, can you stay back? Okay. Okay, ma. Thank you all. Thank you. Have a great day. Thank you.
Okay, ma'am. Bye.
Bye.